Okay, guys, so we have started our series of online lectures, and we have started with the nervous system, and now we're going to go on to the diseases that are going to affect the nervous system of the horses, okay? We are going to start with rabies, which is, in my opinion, one of the most interesting diseases out there. Rabies is 100% lethal. It's deadly. Once you have it, you're going to die. Once a horse has it, a dog, there is no treating rabies in animals. In humans, sometimes you're going to try to treat the humans, obviously, because of their value as a human. And there has been very few people that have actually survived rabies. So it is considered 100% lethal. Just to give you guys an idea, rabies is a viral disease, so it's the virus of rabies, and it affects the nervous system, and it is an infectious disease. It is also very contagious, and it gets transmitted by generally by the bite. The saliva is infected with is full of viruses, and the bite of a rabid animal. So it breaks the skin, and then the viruses get into that area, get to the nerve, find the nerve, the closest nerve, and go to the brain. And once it gets to the brain, that's when it starts to show clinical signs. Okay, so that's generally how the disease goes. Now there is other ways to get rabies as well, but generally speaking, in nature, one animal is going to get from another animal by the bite of the rabid animal, because the saliva is full of viruses. So let me go ahead and share the screen here with you all so we can do this. Okay, so it is a zoonosis, meaning it can transmit from humans to animals and animals to humans. It's lethal. It's 100% deadly. Like I said before, there has been only a few cases that rabies has been treated in humans and that it has been successful. I think like 4 or 5 cases in the world. So what happens is, so let me just tell you two different stories, and then we're going to continue. But one of them, several years ago, this guy died in a car accident, okay? And he was an organ donor, and he donated his organs. So the cornea went, two cornea to a few people, the liver to other people, heart, etc. Okay, so after he died, after the transplant happened, the 4 people that received his organs died of rabies. Okay, how terrible is that? What happened is this: he died in a car accident, but what happened is, a few days before that, he had talked to his people, who, I don't know, neighbors, family, or whatnot, that he had been bitten by a bat. And nobody believed him, or nobody gave any, paid attention to his complaints or whatnot. And he died of a car accident, so there was no need to, he didn't die of a disease. So when the EMS arrived at the scene, they don't know that that guy has been bitten by bats, or by one bat. And so they don't generally test the organs for rabies, okay? Because what's the likelihood? So what happened is, probably when he died of a car accident, he probably was already having the signs for the disease, and that's how he got disoriented or whatnot and was killed that way. And then his organs, because he was an organ donor, got transplanted to people, and then the people later on died of rabies, which is a horrible way to go. The other case that we have about rabies being, in people also, is a few years ago in, I guess it was Milwaukee. There was this girl that saw a bat in the aisleway of a church, picked up the bat, and the bat bit her. Nobody paid any attention. They're like, oh, cute bat, cute bat. I'll tell you what, bats are actually, they have a ton, they pass rabies, and it is a problem. Obviously, that's how the vampire and Dracula story come, because, thirsty for blood, they bite the blood, and then they, everybody that gets bitten gets transformed into a vampire, etc. And they come from bats. So this girl picked up this bat from the aisle of the church, and the bat bit her. And as the bat bit her, a month later, she started having headaches and neurologic signs. It comes to happen that the girl has rabies. So what they did, and that was one of the first cases ever treated, successfully treated. And they actually froze her body, not froze, but they lowered the temperature of her body to like 70, 60 degrees Fahrenheit. So very, very low, to try to stop the metabolism of the body, to hopefully, as the virus runs its course, so they can protect the brain. So when the virus runs its course, hopefully as they bring her back up her temperature, that she is able to survive. So that has become called the Milwaukee Protocol. And I think from that day, they were able to save 4 people after that, doing that same protocol. But in general, there is no cure for rabies. Once you have rabies, it's done, okay? And what happens is this. So like I said, the disease comes from the bite of an infected animal, showing the signs. The saliva is full of viruses. It gets to the area, the virus replicates in the area of the bite, reaches a nerve or a neuron. It goes all the way with the nerve to the brain. Once it gets to the brain, it gets distributed all over the body, including the saliva. And at that point, you start to have clinical signs, or if you're a person, symptoms. And at that point, it's a neurologic disease, so you get disoriented. There is the rabid, the furious type, which the person is angry, the dog is angry, wanting to bite everyone. And then cows get what they call the dumb type, which is they just become more lethargic. It used to be called hydrophobia, so fear of water. Because as soon as water touches the mouth of a person that has rabies, they violently spit it out. It is just a very, very problematic disease. In many, many countries, there's many people that die of rabies annually. So let's see what else I have here to say about this. Hold on. It is universally endemic in mammals. Okay, it's generally a disease that will affect mammals, so hot blooded. I don't know if dolphins or whales get rabies. I guess I need to check that, but it's everywhere. There's only a few countries in the world that are considered to be rabies free, and even those countries, they sometimes have rabies, but only in bats and not in other mammals. Okay. The WHO, the World Health Organization, an organization that we have become very familiar here in the last few weeks, they report the number of rabies deaths in humans, and I am going to actually share that information there with you. Hold on just a second. So here we go. So this is the number of people. So this is reported number of human rabies deaths data by country. So this was for 2000. It's up to 2017, okay, even though it was uploaded in 2019. So you can see how Algeria, 18 people per year. Many countries have no data because they simply don't report. We have here China, 500, 600, 800, 1,000, 2,000 people dying of rabies every year. We have Côte d'Ivory, Ivory Coast, 18 people a year, Ethiopia. So we have like a bunch of people. Kenya, 350. So you can see every year how many people actually die of this particular disease. In the United States, it's generally between 1, 2, 3, 4 people that die of rabies on an annual basis. Okay, so this is important for us to know, so you can see how, you know, it's a problematic disease, especially because there is no cure for the disease. Okay, let's see here what else we have. So this is countries and areas of risk. As you can see, Africa, high risk, medium risk for a lot of South America, obviously parts of Europe, are high risk, very high risk for all this that is in red, and then low risk for the countries that are in yellow, and then New Zealand there is no risk of contacting that disease there. The epidemiology, we already talked about this. It's transmitted to warm-blooded animals by the bite of an infected animal. It's generally fox, raccoon, skunk, bat, etc. These are mammals, okay? In the US, the rabies infection of wild animals is going to occur geographically, and it's very defined by region, okay? And in Kentucky, the culprit, the animal that transmits rabies the most to other animals, the animal that is more also contaminated with rabies is the skunk, okay? People think it would be the raccoon, but it isn't. It's the skunk in Kentucky. The transmission, this is important. Transmission usually occurs within the same species. So when they come to, the species like hang out together most of the time. Very seldom does it occur between the species. What does that mean? Is that when you have that encounter between a horse and a rabbit, and we're going to see here a video of rabbit fox, and the fox bites the horse, but in general would be fox transmitting to foxes, skunks transmitting to skunks, etc. As you can see, here's a map of the United States, so we can see what the main reservoir are for the particular region, geographic region. And as you can see, the raccoon is on the East Coast. There's actually it's a variant rabies virus that affects the raccoons there. It's a little bit different than the rest, but it's still deadly and it's still the same virus, but a little different variant. And in Kentucky, it is the skunk. Okay, here he is. He's cute, but I'll tell you what, he can transmit the disease. Okay, here is, this is from the USDA. The USDA every year puts on the number of cases for rabies across the country, okay, different states, and what kinds of animals were affected every year. Let me go ahead and try to do a highlight here. Highlighter. So just so we can see here in Kentucky, okay? Come on. Kentucky. Generally, total 10 cases. And this is generally wild cases. So as you can see here, 9 for wildlife and 1 for the domesticated animals. Okay, let's see if I can show here. So domestic animals. Is it not showing? What the heck? Domestic animals is generally depending on, it's not responding, Microsoft. I'm gonna pause this in a second until this starts to respond again. Let's start recording again, and let's see if I am able to share the screen again. Hold on, let's see. Share, okay. Let's hopefully it is responding now, but who knows now? It still isn't. Let me pause this again. We'll come back in a second. Okay, let's try this again. I guess I cannot be annotating on the slide. Let's try this again. PowerPoint here. What I'm trying to say is that the USDA will have numbers of cases of wild animals and also domesticated animals every year that we have every year they have a report. Okay, so this is the AVMA, American Veterinary Medical Association journals, and I am going to share what they have annually. Let's see, screen share, this guy here. And this is the rabies surveillance. So this is something that you guys can access anywhere that you are. So rabies surveillance in the United States, in this particular case is 2015. And they have all types of, they continue to figure out what kinds of animals are the reservoirs, how, if there is an increase or decrease in cases. In the case here, as you can see in Kentucky, in this particular year, we had Kentucky 11 cases. 2 of them were domestic animals. 1 of them was a dog, and 1 of them was a horse. So every year in Kentucky, there's going to be, you know, generally 1 or 2 horses that are positive for rabies in Kentucky. And so, you know, it's something that we just need to be thinking about. So this is the report, and you guys can access the report anytime that you want. Pathogenesis, we already talked about this, but the transmission occurs by the bite of an infected animal. The virus is going to multiply in the muscle, and then it travels all the way. It reaches the nerves. It goes all the way to the spinal cord and then to the brain. When it reaches the brain, it gets distributed all over the body, okay? The incubation period may take weeks to months. What does that mean? It is going to depend on where this animal got bitten. So if you're a horse and you get bitten on a leg, it may take months for the disease to actually reach the brain. If you get bitten on the muzzle, as you can think, the muzzle is close to the brain, so it may take just a few days so it can reach the brain. What is important is that once it reaches the brain, the disease rapidly progresses, and within 10 days, the animal dies, or the person. So once it reaches the brain, so I say here, once transient has started, it's rapid. And after it reaches the brain, it passes centrifugally, meaning it goes everywhere in the body, from the brain to tissues and organs, and reaches the salivary gland and nasal secretions. And this is fast. And once it reaches the brain, that's when clinical signs are seen, okay? And the death generally occurs within 10 days. Clinical findings of horses that have rabies. One thing that is important is that the clinical signs are progressive from the onset of clinical signs to death. So once they start, they are progressive, meaning the horse gets worse every single day that it passes, okay? And then death occurs within 10 days. So some of the clinical signs: poor performance, bizarre behavior. The horse can get what we call self-mutilation. They start biting themselves. They start biting everything. They may have seizures, head pressing, just weakness, paralysis. Remember I talked about the hydrophobia, which is the inability to drink water, okay? And one of the most famous, or the ones that we are able to recognize as people, salivation, a lot of salivation. What happens is not only is the animal producing more saliva, it is also unable to swallow the saliva. So with that being said, it can't swallow because of the paralysis of the muscles. Then it starts to salivate, okay? So this is important. Humans, when they get rabies, okay, they need to be tied down and they need to be in isolation. They also get what we call the furious rabies. They get angry, and it's not a good scene to be watched, okay? But we are going to watch a few videos here soon. There's 2 forms of rabies. We have the furious. We already talked about this. The animal becomes angry, hyperexcitable, he is aggressive, okay? And then there's going to be hyperesthesia, which is increased sensitivity to any kind of stimulus. And then there is the dumb type of rabies, and that is generally what herbivores are going to get, such as cows. Well, horses are herbivore and they can get the furious. So generally cows get the dumb, horses get the furious, dogs, any carnivore gets the furious type of rabies. How to differentiate between rabies? How do we know what the animal has? I guess the history, was this animal bitten by another animal? If he was that other animal rabid? Was somebody able to catch the animal, whatever the animal was, and test him? Did the animal simply disappear? Was the animal rabid or not? So those are all things to keep in mind. And then obviously different neurologic types of diseases, such as Eastern and Western encephalitis, West Nile virus, the equine herpes virus type 1, the neurologic type, hepatic encephalopathy, which is a problem in the liver that causes neurologic signs, EPM, and colic. There is no definitive antemortem test for rabies in animals. All need to be done when the animal is dead, because the part of the body that's going to be tested is the brain. So when the animal is a suspect for rabies, after he is euthanized, the brain needs to be sent to the lab to be tested. Diagnosis is going to be based on clinical sign and history. Okay, so those are suggestive and not the final diagnosis. It needs to be done with the brain. Okay, in humans, we are going to have antemortem tests, but not in animals. We can test the saliva, cerebrospinal fluid, etc. In the brain, okay, there is this what we call pathognomonic. Pathognomonic means a type of exam or a type of clinical sign that is very well established in that particular disease, and no other disease has the exact same clinical sign. And that's exactly what causes, what happens in rabies, is that in the brain, we're going to have what we call this Negri bodies, okay, which is this little black little guys here that will stain, as you stain the brain tissue, and they show up in cases of rabies. And that's the pathognomonic diagnosis for rabies, okay? So it's these little guys here in the brain. Obviously, as I said, can only happen if the animal is dead, because you can just remove the brain of an animal that's alive. Treatment, there is no therapy. There is no treatment for rabies once the animal has, humans, obviously, we're going to try to treat, but generally it's 100% lethal. There is no treatment for animals for sure. Horses exposed to a confirmed case need to be observed. They can be revaccinated for rabies, okay? Herbivore to herbivore transmission is very uncommon. It's generally carnivore to herbivore, but this is important. Horses, so the American Association of Equine Practitioners recommend vaccinating for rabies every year. Okay, and if the horse gets bitten by an animal, by a wildlife animal, it needs to be revaccinated and then observed for 45 days. Okay, if he starts to develop clinical signs of neurologic types of clinical signs, that horse then needs to be, depending on the clinical signs, maybe euthanized, and then the brain needs to be tested. How do we prevent? So annual vaccination, like I said, the AAP has a list of vaccines that they consider important that every animal needs to get, and it's called the core vaccines, and they are going to include rabies, tetanus, Eastern and Western encephalitis, and West Nile virus. Those 5 diseases every horse needs to receive those 5 particular vaccines for those 5 diseases annually, okay? Other ways to prevent is to avoid exposure, so minimize contact with wildlife as much as possible. Secure garbage cans, obviously, so you don't attract wildlife to your property, such as raccoons or skunks, etc. Do not leave pet food outside, again, to try to not have wildlife that can possibly be contaminated with rabies. Rabies is very rare in vaccinated individuals, but it may happen, but it's very, 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 very rare. Now we're gonna have a few videos here that we're gonna watch. I'm gonna warn you, some of them are a little hard to watch, okay? So just be warned, because it's a little weird to watch a few of these things because it's upsetting, okay? Let's see, rabies. So this is, let me mute this guy here. And this is rabies in humans. And you're going to see, this is a node video, but you're going to see, so this guy has rabies. So you see he has like some sort of, he's trying to talk. and he's still not as advanced in the disease. But remember I said when the water touches the tongue, what happens? They can't swallow. They just can't. This is one of the pathognomonic also signs of rabies. They can't swallow the water, and it just becomes worse as the disease progresses, okay? He's trying to swallow, he just can't. The muscles to swallow don't work. So here he starts to salivate. Look at this person and he tried to bite. Did you guys see that? Hold on. Okay. This person, obviously this is a very old video, without gloves. This is so bad, it's horrible. In today's way that we do, it's like you have to put full hazmat clothing on to deal with an animal that has rabies. But you can see the amount of salivation that happens, and then the person should be tied because they get so angry and so furious they run around, and they then can contaminate pretty much everybody. So the person gets tied. Maybe, I don't know, maybe they can get sedated until they actually pretty much wait for their death and die. So it's very sad. Horse, I think this is in India. So let me also mute this guy here. So horse contaminated, you can see he is trying, let me go back to the beginning. They put a muzzle on him to try to prevent, but he is biting himself. Look at him trying to bite himself. He grabs his chest. He's so angry. This is called self-mutilation, okay? He's angry, he's upset. This area right here, and I don't know if the little video will show the arrow, it's him biting the concrete, okay? He bites, so angry that he is. And you can just see it is not a normal behavior for an animal. Let me see if I can see him biting the concrete. You see the little sore that he has developed there. Did a guy try to come? So he's like biting himself. I want you guys to see him biting the concrete, the wall. Just get so upset. I mean, and there really isn't any, oh, him, there, you saw? Bite the wall. And this is what, you want to start to bite the wall again. Oh, it's terrible. Oh, excuse me. Oh, did you see the face of the pony? So angry at the guy that passed by. Biting the wall. So anyway, so this is the furious type. Oh, angry. The furious type. Once this happens, the animal dies within 10 days for sure. Okay. Look at him. Were they gonna hit him? I don't know. So this is another video. Let me see if we find another one. No. Hold on. And this now is a dog. Let me silence this also. You see, angry. Okay, so angry, biting. Look at his eyes. They start, oh, so angry, vicious. So this is generally a sign of rabies also, okay? When a dog, and that's why in developing countries, these dogs, if they don't have control, some dogs just like get rabid and go to streets and bite other people. And I will refuse to be those people that will allow just another video to play. They just bite other people, and they that's how they get the disease, okay? Because of dogs, that simply are roaming the streets because these dogs are so angry. Okay, another horse with rabies. You see neurologic signs. Okay, the lip is twitching. Oh my gosh, why so close? So these are some of the clinical signs. Oh, he tried to bite. Some of the clinical signs of the disease. Oh, trying to bite. Very angry, okay? They get angry. Let me go back here. Delete. And then this is a fox showing signs of rabies. Okay, very neurologic signs. I just saw a video of a raccoon showing signs of rabies, like salivating. And this woman making the video thinking, oh my gosh, so sad, let's go rescue him. There is no rescuing, guys, okay? This is a very problematic disease. So this is a fox showing neurologic signs. Look at the amount of saliva coming out of this fox's mouth, okay? Angry animal. Okay, and then this, I'm sure you guys have seen this, but if you haven't, here you go. This is this fox that comes out here and bites this horse, but the horse had been vaccinated. But this is exactly how animals, and the poor horse had a muzzle because he's fat, and this is how animals can get rabies. So obviously the person that's making the video doesn't think that the animal is rabid. But once the horse actually killed the fox and the fox actually bit the horse, they tested the fox and then they realized that the fox had rabies. Okay, so this is just some of the clinical signs of the rabies. Let me go back to the PowerPoint and see where we need to be. Let's see. I guess that's it. Anyway, guys, so this is, stop, shared window is closed, okay. So this is just, rabies in humans, rabies in animals, and the amount of care that we have to have. If we see an animal acting differently than it's the normal behavior for that particular animal, let's not go and pet these animals. And here's the other thing too, bats. Bats in most countries are the reservoir for rabies, okay? So some people think that bats are cute. Bats may be cute, but they can be very problematic and they can be the reservoir for rabies. Like I said, the Dracula, the vampire story, okay? There are barns that they keep bats to eat the insects. But here's the thing, why would you do that? Use other ways to control the insect population in your barn. You don't want to attract bats to your facility because some of them may have rabies and we don't even know, okay? Unless we test them. So if you have any questions, don't hesitate to send me an email. I will talk to you later, guys. Bye.